Trauma changes everything. The way we think, the way we feel, the way we experience the world and relate to others. But the most powerful changes happen deep within the brain. For many, trauma doesn't just leave emotional scars, it rewires the nervous system itself. In this video, we'll explore what trauma does to the brain, how it impacts emotion, memory, and behavior, and how ketamine therapy, combined with integration, offers a path toward healing, growth, and peace. The amygdala, the brain's alarm system. The amygdala is your brain's built-in alarm system. It's responsible for processing emotions like fear, anxiety, and threat detection. When trauma occurs, the amygdala goes into overdrive. When this happens, your brain becomes hyper-aware of danger, even when you're safe. This overactivation causes you to feel constantly on edge, hypervigilant, and emotionally overwhelmed. You may feel startled easily, struggle to sleep, or experience panic for no apparent reason. It can also fuel impulsive reactions, like anger or shutting down completely. And because the amygdala plays a role in emotional memory, it can trap you in a cycle of reliving the past. The prefrontal cortex, the control center. The prefrontal cortex, or PFC, is responsible for logic, decision-making, and regulating your emotions. Think of it as your brain's CEO. But trauma weakens the PFC. That means when emotions run high, your PFC can't step in to calm things down. You may feel like you're losing control, making poor decisions, or saying things you regret. This shutdown makes it difficult to pause, reflect, or choose healthier responses. And without this emotional regulation, the amygdala stays in charge, keeping you stuck in survival mode. The anterior cingulate cortex. The anterior cingulate cortex is like a bridge between your thoughts and feelings. It connects the logical brain with your emotional responses and helps you regulate pain, both physical and emotional. After trauma, this bridge breaks down. The result? It becomes harder to manage emotional pain or connect with others. You may feel emotionally numb or easily overwhelmed. You might avoid relationships because they feel too intense or too risky. The default mode network. The default mode network is the part of your brain that activates when you're resting, daydreaming, or thinking about yourself. It governs your self-talk, memories, and how you interpret your life. In trauma survivors, the default mode network becomes overactive, especially in areas tied to self-awareness and physical pain. This leads to rumination or repetitive, negative self-talk. I'm not good enough. This is all my fault. No one really cares. Over time, these thought loops shape how you see yourself and others, reinforcing shame, guilt, and disconnection. Trauma doesn't just damage the body, it damages the story we tell ourselves about who we are. Part 2. How trauma disrupts emotion control. Normally, the prefrontal cortex and the amygdala work together like a team. When the amygdala sounds the alarm, the PFC checks the facts and calms things down. But trauma breaks that connection, a condition called frontolimbic disconnectivity. The amygdala stays hyperactive, while the PFC becomes weak and silent. The result is emotional chaos. You feel overwhelmed, unsafe, and reactive. You may experience mood swings, emotional outbursts, or feel like your emotions are running the show. Some people get so used to this internal chaos that negative thinking becomes familiar, even comforting. It becomes a habit the brain clings to, even when it hurts. Part 3. Childhood trauma and the developing brain. Adverse childhood experiences, like neglect, abuse, or unstable environments, have a profound effect on the growing brain. In children, trauma increases blood flow to survival regions like the amygdala and decreases activity in areas like the PFC and temporal lobes. This affects memory, learning, and emotional development. The brain also learns to expect pain, especially emotional pain. It adjusts by lowering natural opioid levels, which leads to chronic discomfort and emotional numbness. In response, some people turn to physical pain, like self-harm, as a way to feel temporary relief. This disruption in the brain's natural pain relief system can also increase sensitivity to social rejection, intensifying feelings of shame, isolation, and unworthiness. Part 4. How ketamine helps. Ketamine is a fast-acting treatment that works in the brain in a completely different way than traditional antidepressants. Here's how it helps. Stop suicidal thoughts. Unlike antidepressants that take weeks, ketamine can reduce suicidal thoughts within hours. Many patients report feeling mental relief after just one session. Interrupts negative thought loops. Ketamine calms the default mode network, breaking the cycle of repetitive, self-critical thoughts. It gives your brain a chance to breathe, quiets the amygdala. By reducing activity in the amygdala, ketamine lowers fear and anxiety, helping patients feel safer and more emotionally balanced. Boosts emotional resilience. Ketamine restores function in the prefrontal cortex and increases connectivity between brain regions, helping you manage stress, make decisions, and regulate your mood more effectively. Part 5. Long-term healing through neuroplasticity. Ketamine doesn't just offer short-term relief, it promotes neuroplasticity, your brain's ability to grow and adapt. By activating NMDA receptors, ketamine stimulates new brain cell connections. It's like clearing away debris after a storm and helping new pathways form. Over time, this leads to better emotional regulation, clearer thinking, healthier responses to stress, stronger relationships and social engagement, decreased pain, both physical and emotional. Ketamine also helps normalize the opioid system, restoring your ability to feel comfort, safety, and even joy in everyday experiences. Part 6. Integration. Turning insight into transformation. While ketamine opens the door, integration is what helps you walk through it. Integration is the process of making sense of your experience and applying it to your life. At WholeMind Healing Pathways, integration includes guided therapy, journaling, mindfulness, and emotional processing. We help you take what you've seen and felt in your ketamine session and turn it into lasting change. It's where new insights become new habits, and new thoughts become a new life. Trauma may change the brain, but the brain can heal. With ketamine therapy and integration, it's possible to reclaim peace, clarity, and connection. If you're struggling with trauma, depression, anxiety, or suicidal thoughts, know this: healing is possible, and it can begin today. Reach out to WholeMind Healing Pathways. We're here to walk with you every step of the way.